Hi, my name is Chelsea Day, and I'm an orthobiologics product manager at Arthrex. Today I'm here with Surgeon Kirk McCullough from Kansas City. Dr. McCullough is going to introduce us to the BioSurge product line. Thank you for joining us today, Dr. McCullough.
Thank you very much for having me.
So Dr. McCullough, can you tell us what is BioSurge?
BioSurge is a convenience kit that allows us to combine the Allison bone graft line with the Angel concentration system to combine a patient's osteoinductive potential with the osteoconductive nature of the Allison bone graft.
Great. So why is it important to you as a surgeon to be able to combine concentrated bone marrow with your bone grafts?
With any of these bone grafting procedures that we perform, it's important to try to maximize the osteoinductive nature of whatever that graft is. So the Angel system allows us to concentrate and harness the patient's own osteoinductive potential by concentrating those cells and those factors that are needed to create callus and create bone, along with an efficacious allograft osteoconductive structure to maximize that potential on both fronts.
So basically cell signal scaffold.
Absolutely.
Yeah. Okay, so you mentioned the cell component that comes from your harvested BMA. What are your thoughts on BMA versus BMC? And do you think it's necessary to take that extra step?
Well, certainly from the initial literature, we know that a BMA alone is efficacious in trying to help an early non-union go on to union. However, if you look at the literature, the JBJS study by Hernigue that was published in 2005 showed that the concentration of colony-forming units at a site when you're using a bone marrow aspirate compared to a concentrated bone marrow aspirate can matter clinically as far as a fracture that will go on to a union versus non-union. So for me in that scenario, the more we can concentrate those factors, not only simply hypothetically, but even with that study clinically, shows that the concentration and the overall amount of factors at that site matter.
So you personally always choose to concentrate your BMA?
Absolutely.
You've discussed the innovation behind the Arthrex Angel system. Let's talk about the AlloSync bone grafts. What is it about AlloSync grafts that set them apart from other bone void solutions on the market?
First off, with the AlloSync Pure, one of the important things that distinguishes it from the other offerings on the market is that it's 100% bone. So there's no carrier that's needed to allow it to either be placed or, more importantly then secondarily, its ability to resist irrigation. So a carrier is not needed, 100% bone, and yet it's still able to resist dissolving or being washed away with irrigation.
So basically there's no fear of graft migration after placement.
That's correct.
So the BioSurge line also contains an option with cortical fibers. Can you tell us a little bit about the cortical fibers and when you would use those?
Yeah, so with cortical fibers, certainly in a open grafting situation rather than one that is being done percutaneously with an injectable, the advantage of the cortical fibers is that the higher concentration of BMPs can be utilized in that scenario while still combining the osteoinductive potential of your Angel harvest.
And lastly, we know that the BioSurge line contains a kit with our demineralized cancellous sponges. Can you talk a little bit about those?
Yeah, well, the sponges, the nice thing about them is that they're compressible, and whatever those sponges are hydrated with holds onto those cells and those products and allows them then to stay directly at the repair site that you're trying to hold them at. So the advantage of them is they can fit within an uneven space, stay in that space, and wick up whatever you've hydrated them with to hold it and maintain that concentration of whatever cell or product that is at the site.
That sounds kind of like a biologic Band-Aid.
Exactly, because it absorbs and it stays exactly where you place it and allows those cells and the products that you've placed within that to stay at that site rather than migrating or being washed away to go somewhere else.
Now, where do you as a surgeon see yourself using these kits?
I think there's a lot of different potential for this, whether it's in percutaneous techniques or open techniques, whether that's an open debridement of a non-union that is being replated and refixed, whether that's a situation where it's a high-risk stress fracture, such as in the scaphoid of the wrist, the navicular of the foot, the fifth metatarsal of the foot, or any high-risk area such as the distal tibia, proximal tibia, where you not only want to try to add a scaffold to allow healing in a defect, but you also want to try to concentrate the body's potential to be able to heal that at the time of fixation.
Right, so the healing triad with cell signal scaffold.
That's exactly what we're trying to do with the BioSurge kit. We want to be able to harness the body's osteoinductive potential with the AlloSync osteoconductive scaffold to then allow us to have that cell signal and scaffold on a convenience kit to allow the surgeon to be able to treat whatever problematic fracture or non-union that they face.
Well, thank you, Dr. McCullough, for answering all of our questions and educating us on the innovation behind the BioSurge line.
And thank you for having me.
For the most up-to-date information on BioSurge, please visit arthrex.com.